Hello and welcome to How to Survive Healthcare. I am Kayla Thompson-Riviere. I have over a decade of experience as an RN in the ER and ICU. Now I'm helping people as a dedicated advocate.
And I'm Nicole Broadhurst, a healthcare billing specialist and financial advocate, here to make sure you're not paying more than you owe.
We're here to share the insider tips and tricks you need to navigate the healthcare system, avoid common pitfalls, and get the care you deserve.
Because no one should feel lost or overwhelmed when it comes to their health.
Now, it is important to note that the information we share on this podcast is based on our experience and research, but it's not intended to replace professional medical advice. But whether you're a patient or a caregiver, you're in the right place. All right. Welcome back to the podcast, everybody. This is our special bonus episodes for the relaunch here this week. Now that Nicole is a permanent co-host on How to Survive Healthcare. So excited you're here, Nicole.
Thanks, Kayla. I'm super excited to be here.
So today we're going to really shine a spotlight on Nicole. You may recall we mentioned her background is in billing and insurance, and she is, guys, an expert. So today she's going to share with us a little bit about Medicare and the home health care benefits so you can better understand those things, because I'm betting there are some things that you might think are covered that probably actually aren't. So Nicole, take it away.
Yes. Thanks so much, Kayla. I'm super excited. This is one of those benefits that I love to talk about because I really feel like it is underutilized. And so I'm hoping that today's conversation will help people better understand it and be able to leverage it and utilize it to help themselves and their loved ones more in the home. So Medicare does have a home health benefit. Okay. And so there are pieces of this. It's designed to provide support and assistance inside your home and help support you through recovery and some of the other chronic illnesses that you might have. We see a lot of the major chronic illnesses like COPD, which is, help me out, Kayla.
Chronic obstructive pulmonary disorder.
Obstructive pulmonary disease, right? Okay, and then congestive heart failure, and then of course recovery from surgeries and those types of things are also types of things that can be covered in the home. So if you are looking to get this kind of support in the home, your loved one's home, this is what you need to know about it. You do have to qualify for the benefit. Okay. So there are some pieces of qualification, and we'll get into the specifics of those. One of which is being homebound. We'll talk about that in a few minutes. The second is that it has to be ordered by a physician, which is not really out of the ordinary, right? Anything that you need to get coverage from any kind of insurance, really we need an order from a physician, and home care is no different, right? We still need a physician to be directing this care. Okay, so what is covered under Medicare home health benefits? You can get a visiting nurse to come into the home. You can have visiting therapists come into the home and do therapy in your home with you. You can have a social worker, a licensed social worker come in and help inside the home. And then, of course, any kind of medical equipment needs that you might need: walkers, wheelchairs, grab bars, bath stools, like benches to put in the bathtub so that you can elevate and not have to get down into the bathtub. Those types of adaptive devices
Commodes, things to go on the toilet seat to bring it higher. Yeah.
Yes, those types of
durable medical equipment. You've also heard it called DME.
Yes, those things are covered. You can even have a certified nursing assistant come in and help with bathing. Okay, so these are all things that can be covered under this benefit. However, and this is where we get to what is not covered. So while these are eligible services to be provided in the home, they will not be there all the time. Okay, so you may be able to get an assistant to come help you bathe once or twice a week, and they will only be in the home while they are assisting you with your daily activities of bathing. The therapist, again, depending on the order from the physician, will only come 2 or 3 times a week, depending on how much therapy you need. And then your visiting nurse, it's the same thing. The visiting nurse may only come once a week, twice a week, depending if you have a lot of medical needs, maybe 3 times a week. But these are not support services that are going to be available 24 hours a day, right? That's just not how that benefit works. It leverages the word intermittent. So these are intermittent skilled nursing needs, skilled services. So intermittent being the real operative word here in regards to that. So, okay, so we talked about what the benefit is, what it kind of covers. Let's talk about eligibility. And this is really important. Like, what does it look like to be eligible for the benefit? Well, you have to be homebound. And one of the things that it talks about, and this is kind of a tricky thing, because immediately that makes me think of somebody who's in the bed and like can't get out of the house, right? But I want to make sure you understand that it's not that dramatic. It really requires that there be some sort of assistive device that somebody needs in order to get in and out of the home. So
Okay.
if they're using crutches or a walker or a wheelchair. The other piece of that is that it has to be considered taxing for the family and or the patient to get out of the home. So if it's really hard to get mom up and down the stairs out of the front door, that can be considered taxing, right?
Sure.
So it doesn't necessarily mean that you're bedbound. It just means that getting in and out of your home is a challenge. Like it's a production. Like, right, you guys know what I'm talking about, where we talk about mom has to go to the grocery store. Oh my gosh, I'm going to have to take time off. I need to get over there.
Right.
We've got to like build the ramp. Like it's a big deal. That's what that kind of looks like. It doesn't mean she can never leave. It just means that
Sure.
it has to be a big deal.
Now, in your experience, can it be challenging to get Medicare to agree with your determination of what is taxing and maybe their determination?
So this is a great conversation, because really this is going to boil down to the answer. The short answer is I don't think it is.
Okay.
Having worked in home health, I don't think it is really hard to get that qualification. It really is pivotal to the next section, where we're going to run into this kind of pushes us right into like how to access this benefit, right? So it hinges on a physician saying you need these services.
Okay.
So it starts with, okay, the way to access the benefit is a physician's visit. It's called a face-to-face encounter. Okay. And really, this just really simply, that just means that the patient goes to the doctor and has an appointment, meets face-to-face, and the physician says, yes, I think that you would benefit from having intermittent services in your home. And I'm going to write the orders and I will certify that you need these services. And so once that face-to-face encounter is had, that appointment is had, and then the physician certifies that you need these intermittent services at home, then you can find an agency, a home health agency, that can actually provide the services. Okay. So for me, accessing the benefit is really about knowing it's available and then asking your doctor for it.
Right. Because just because you're having a hard time showing up to that doctor's appointment doesn't mean that it's going to pop into their head that you may be looking for this benefit. This is another example of you have to know what outcome you're trying to reach before you have your doctor's appointment.
That's right. That's exactly right. And the physician when you see your physician, the physician doesn't always know how much effort it took for you to get into the
Right.
exam room,
Right.
right? So unless you're saying, hey, this is a real, like, this is hard for us to get here. Is it possible for us to get some of these services in the home? That kind of triggers that conversation. So once you
Sure.
have the appointment, you get the certification, then you can start shopping for a home health agency, right? That can then provide these services to you. Now, it's important to know that the physician does need to recertify you every 60 days that you're receiving these services. Okay. And so, as long as the physician continues to recertify, you should be just fine in getting these benefits at home. It is important to remember that as family members, we play a role in this, right? This is kind of additional services, and coordinating the care sometimes falls on us as family members or as patients. And when I talk about this, what I'm really meaning is I've had clients where it was beneficial for them to be seen at least every other day. And so I would work with the home health agency and say, if the nurse comes out on Monday, can we have occupational therapy on Wednesday and
Right.
then
Right.
maybe physical therapy on Friday and the aid on, to try and coordinate that. That's not something, if we don't ask for that, we're not going to get that kind of
Right.
coordination.
Right.
So it's important that if you want, otherwise, sometimes services might be stacked on the same day and make a really long, tiring day if we have the nurse come out and then the therapist come out and then the aide come out all
Right.
at the same time. And then it also leaves, 4 days in a row where we don't have anyone in the home with providing services. So that's something to think about as well. I'm trying to think about, those are really the biggest things. Kayla, what kind of questions do you have as we kind of walk through that
Sure.
maybe folks are asking?
Yeah. So if I am the family member who is taking care of my mom and she has congestive heart failure and it's hard to get in and out of the house, and we want to get this appointment for the face to face for what was the phrase you used?
Yeah, it's called a face-to-face encounter.
That
Uh,
encounter.
yeah.
Um, a couple questions. Number one, does that need to be face to face or could that be a virtual appointment?
So I know that they lifted the actual face-to-face during the pandemic, but I believe that is back, that's been revoked, and it does need to be an in-person, in-office visit. That's
That's
part
interesting to
of the
me
certification.
when we're talking
Yeah,
about how taxing it is to get mom out of the house. But
yeah,
okay.
yeah, yeah,
Second
yeah,
question.
right,
Things about healthcare if I was queen and ran the world.
right. Me too.
Yeah. Second question. If this is because mom has congestive heart failure, which is typically treated by her cardiologist, is this something she can get from her cardiologist, or does this
Yes.
work better through primary care?
Yeah, so any physician who is Medicare certified, so any physician who bills Medicare is eligible to do the certification. I will tell you this, that because there is an ongoing responsibility in recertifying, sometimes it is challenging to get specialists to write the order.
Challenging
Sometimes this
is
takes,
a nice
yes,
word. Yeah. So that's
yeah,
kind of where I was thinking and going with this. Although it may be for a condition related to something the specialist is treating, like the heart in the case of CHF or the lung doctor in the case of COPD, in my experience,
yes,
specialists typically don't want to get involved with anything beyond just their focused medical care.
right,
And especially with that ongoing piece, you are going to be
yeah,
more likely to have success without so many blockades going the route of primary care.
I agree. I agree. That has been my experience as well.
Now, I have heard sometimes people have trouble getting finding aides or certified nursing assistants who will take the Medicare. Can you speak to that for a minute?
Yeah. So, like many things in healthcare, there are shortages of providers. And I will tell you that the aid population is racked with availability issues, access issues, and that's across the board. So I think this is a really good question that when you're looking for an agency, if that piece is paramount to the services that you're looking for, make sure you're asking them about their aids availability upfront before you sign on. If that is something that you absolutely is non-negotiable, you're going to want to make sure that before you sign with an agency, you've already had this conversation and that they've committed that they have somebody available to do that, because it is challenging and it just is.
Yeah. Yeah, and there are in my not my personal experience, but through taking care of patients and speaking with them over the years, particularly in our area, it can be hard to find an aide who's willing to take Medicare because, frankly, a lot of them are able to work for private pay,
Right.
which is a lot more than Medicare pay. And
Yeah.
I mean, I can't blame them. I get the logic. Why would you do the same job for half the pay? So
Right.
that could be a barrier. And also, I've had quite a few clients who have ongoing care needs, and they have found that the quality of care they receive from the
Mm.
aides who are willing to accept Medicare versus the ones who aren't, there can be a difference there as well. Of course, that's not across the board, but just things to keep in mind as you are trying to figure out what's going to be the best care plan for you.
Right. That's a really interesting thing to talk about, because I think when I think about it, it's important. I want to make sure that we're really clear on what we're talking about. The service of a certified aide to come in. This is the person that comes in and helps with dressing and bathing and those activities of daily living that we need. And typically it is a piece of the Medicare benefit that will be administered by the home health agency. And so what Kayla is talking about is the reason that it's hard to get that service under the Medicare benefit through the agency is because the people who do the work, so certified aides, are choosing to work under private duty where they make more money instead of being employed by the agency that is administering Medicare benefits to patients. And that is true. And that's why you want to ask that question up front. Now, I do want to say, if that is a paramount piece of your care, understand that there's nothing saying that you can't hire a private duty certified
Right.
aide in addition to the Medicare benefit that you're getting. And we see that a lot. I saw that as an administrator of home health agencies, where we just weren't able to meet that particular need. And so we had patients that did, because maybe if you're accessing the Medicare benefit, it leaves a little bit more finances available to kind of supplement, right? If we're not having to pay for a visiting nurse or a therapist, then we can take
Right.
some of those dollars and pay privately. So there's no conflict there. If you choose, you can have both. You can pay a
Yeah.
private aid and have your Medicare benefits.
Yeah, and there's no right answer or wrong answer. It's just these are little pieces to keep in mind as you are trying to figure out
Sure.
what is the best plan for your loved one.
Right. Exactly.
So, well, thank you so much, Nicole, for going over this because I think it can be very confusing. Oh, I'm sorry. One more question. Can you also speak to the amount of time in the home that Medicare will cover for that aid?
Yes. So it's typically usually it's an hour per visit is what they expect to do. So an hour for a bath, a shower, assisting, that type of thing. This doesn't cover, I do want to say, it does not cover anything like cleaning, cooking, laundry, unless there's, it doesn't cover any of that stuff, that cooking, the cleaning, the laundry, the mopping, like it just doesn't cover that. It's only things that are directly related to bathing and assisting, sometimes in transfers and those types of things. The other thing I almost forgot, and I want to make sure that we talk about this a little bit, is there is no, like, this benefit does not turn on and turn off based on improvement.
Okay.
Okay. The benefit itself is available to maintain and or improve the quality of life of the beneficiary, so the patient. So it's not like if you don't meet goals, then you lose the benefit. It
So
doesn't work that
it's
way.
different from the way the short-term rehab kind of benefit
Yeah, it's
works.
really interesting. That's a whole nother conversation. But yes,
Oh
and yeah,
yeah.
because so I have had patients who have been under the Medicare home health benefit literally for years. So I just want to say that, it's not, it is possible, and that there's not an improvement criteria that's required.
Sure. And you don't need a hospital stay to trigger
No,
this.
no,
Yeah, that's
no.
probably
You
that's an
need a
important
physician. Yeah,
note.
right. Exactly. Yep, it's that face-to-face encounter and that physician certification.
Perfect. All right. Well, thank you so much, Nicole.
Thank you.
If this is something that you're struggling with or trying to figure out, or maybe you've been getting the ball rolling, but it's getting dropped somewhere, and you just need help getting services for you or your loved one, please don't hesitate to reach out. You can find me and Nicole at how2sh.com, and we'll be happy to get you pointed in the right direction or working on your case, making the phone calls, whatever's the best fit for you. So I hope this was helpful. Thank you so much for listening, guys. And we'll be back tomorrow with a special bonus episode of this relaunch here. Thank you so much. Bye bye.